depending on the reason for the hydrocele, if they don't go away on their own, they may require procedure. My name is Dr. Diana Cardona-Grau, and I'm a pediatric urologist with Orlando Health. A hydrocele is an accumulation of fluid around the testicle. We see it commonly in newborns and infants. If it arises later on and the pediatrician hasn't seen it, it's always good to get it checked out. Now, if the swelling in the scrotum is all of a sudden or associated with other things such as pain, redness, or increased fussiness in a baby, it's always good to get it checked out, sometimes more urgently than others. So cryptorchidism, or basically an undescended testicle, is when the testicle doesn't complete its descent. So when babies are developing, the testicles start up in the abdomen, and in the third trimester they come down into their final location, which is the scrotum. Some signs can be basically that one side of the scrotum looks fuller than the other, or of course the opposite would be that the side looks empty. Sometimes the testicle just doesn't make it all the way there. It's more common in premature infants because they don't have that period of time in the third trimester to complete the descent. Sometimes we think some hormonal factors, but usually it's just it doesn't make it all the way down. A very important reason to get it evaluated and to get it corrected if it doesn't come down on its own is that the scrotal sac is about 3 to 5 degrees cooler than the rest of the body, and the testicles, like I said, are designed to be at that temperature, and so being at the higher temperatures may affect the growth and the development of the testicle. In the future may affect the healthy sperm production. It does increase the risk of testicular cancer. If the testicle hasn't come down by the time the baby is born, there is still a period of time within the first 6 months of life that we can give that testicle to see if it will come down on its own. If by 6 months to a year it hasn't come into the scrotum, most likely it will not come in. At that point, we would probably be evaluating you with pediatric urology and recommend surgery to bring it down.